Continue to talk about just the overall system as a whole. And when you're looking at your department and going to the legislature, this is a time where a lot of directors will have to present their case before lawmakers about their priorities. What would you say are your top priorities as you approach the legislature? What would you like to see done this legislative session?
Our top three priorities would be one, to continue with the planning and design for the new OCCC. Two is to receive the $45 million we're asking for to build a consolidated healthcare unit at Halawa, which will be able then to better service the people in our custody and care with not just, it'll be 41 beds, but it's not just medical beds, it's also mental health and suicide beds as well. I'd also like the money to replace the $18 million to replace the fencing around the Halawa Correctional Facility, which is the original fencing from 1985 or 87 when it opened up, to replace the fencing around the Maui Community Correctional Center, which is also old, and for the money for the planning and design for the jail in OCCC, for HCCC, to have a smaller jail in Kona, preferably near the courthouse. I mean, if we can get those things done, we can relieve overcrowding, we can increase our ability to provide appropriate levels of medical and mental health care to our population.
We always like to invite the comments in from the public, and we've got quite a few people responding on Facebook right now. And one of them is saying, the prisoners are developing mental illness from incarceration, that the experience itself can be pretty traumatic. What kind of services are there for the prisoners who are incarcerated to make sure that, given the circumstances that they're in, that doesn't exacerbate issues that they have?
Well, we do have mental health services available and nursing services available. We have social workers and psychologists in the facility. And the person is correct. Sometimes people incarcerated are traumatized by the period of incarceration itself, because there's a huge change from being free to have somebody tell you when you can go eat, when you're going to go shower, and you also have to be careful of the people around you in the prison, because not everybody's your friend in the prison setting. So I agree, but we do have the services available. We do have sick call every day in the correctional facilities, and people in our custody and care, whether they're pretrial or sentenced, are able to see medical.
Unfortunately, you are taking over a department that has had a history of some corruption. There has been some things that have happened within certain leadership and those who have held posts and positions within the department and working in some of these prisons that have abused their powers. As someone who is taking over the leadership of this, how do you address some of those stigmas that currently exist still in the community about just the overall transparency of the division, as well as people feeling confident in the leadership that now run these facilities?
Well, I think you go out to shows like this. If reporters ask for an interview and you have the ability to, you should interview with them, and you should tell the public the truth as much as you can. Certain things may be still in investigation, and we can only mention some things, but I think we should be as open and transparent as possible. We should always hold our employees accountable, and we should also hold ourselves accountable as well. But there's a lot of misinformation out there, so we have to do a better job of getting the good information out there. I'll give you an example. Someone walks away from work furloughed, that makes the news, and that's fine. But there's 1,000 things that go right every day in the correctional facilities. We have to do a better job of getting that information out there so they can see it's a balance. We can't control human behavior. If an inmate decides to walk away from work furlough, they've earned their way there, they met all the criteria. The vast majority of the time, it's because of relationship issues, to be perfectly frank. So maybe we need to do a better job of the resocialization aspect, to do a cognitive refresher, to remind them, hey, you worked a long time to get here. Don't mess this up, deviating from a past to go see your girlfriend.
The kind of change that you're talking about, that we started out, the name change itself from Department of Public Safety to Corrections and Rehabilitation, that kind of a shift, I'd imagine that it's going to take some time. What are the metrics that you use to measure success? How do you know that things are working and that you are making the steps toward that rehabilitation kind of system that you're hoping for?
Well, first I ordered all of our programs to do a review to make sure that the programs we're providing are evidence-based and it's updated. I'll give you an example. Our Cash Box program, where we have a therapeutic substance abuse treatment program, level 3, which is the highest level, the curriculum is 25 years old. So I ordered the curriculum to be reviewed, because now you're talking 2.5 generations ago. So the values of the offender may have changed and their experience have changed. So we need to make sure that the curriculum is updated to deal with those things. So I think it's not going to be easy and it's not going to be quick. But I think doing things like that to try to look and make sure that we're providing evidence-based programs and that we make the systemic changes we need. I think that's the best way to show that we're serious about changing. And we're going to have hiccups, but we need to learn from those hiccups and we need to move on. We have to keep moving forward. Just because it's hard doesn't mean we should stop.